Good morning, everyone. Well, I'm happy to see you all again here, and thank you for bearing with us for last 5 days. I realized this morning that we are already into the fifth day of our course, and that really excites me personally because the way your ideas are shaping up are going to really take us, like much deeper in understanding this wider field of health policy and systems research. So by now, I assume we have got a fair enough idea about what health systems is all about. Today, we are going to look into the other aspect of HPSR, which is the health policy side. So the way I have structured my today's lecture is, we'll start with a brief introduction, try to understand what policy is. Then we'll look into different health policy making cycles, and then end trying to understand or give a deeper look at what the health policy triangle means for us. Okay, to begin with, what is a policy? Any thoughts? Please take the mic, so if you're responding, then everybody can hear what you're saying. What comes to your mind when you hear the word health policy?
Sir, policy is it's like set of guidelines or protocols. It's not like policy is not something practical. Policy is something like an assumption or theory. So we can implement that through an entity or something called as program. That's what I feel policy is.
Okay. Anybody else? That's fine. Anybody else? Yeah?
Policy is a logical framework of guideline for achievement of intended object.
Okay. Yes, it's a logical framework that guides us. Any final one? Yeah? Correct. It has some kind of a purpose. Okay. So the simplest definition I will give, it's a bundle of decisions. Okay. It's not one particular decision, but it's a bundle of decision. And as one of you have rightly said, a policy may be thought of a system which provides the logical framework and rationality of decision making for achievement of intended objectives. Okay, quite a broad definition, but there are definitely some scholars who have provided us with very interesting definitions, like as Anderson would say, it's a relative stable purposive course of action. There is a purpose behind that action that is followed by an actor or a set of actors in dealing with a problem or matter of concern. Policy is also as the product of political influence, determining and setting limits to what the state does. Well, the last one is something which I find interesting, is like what government chooses to do or not to do. Well, policies could be private or they can be from the public sector. For instance, there could be a group of multinational companies and they might have individual policies for companies in individual countries. A public sector policy may widely refer to the government policy. Sometimes it is also differentiated between a policy and a program. For instance, the government schools health program may include a number of different policies. So in that case, the program is the embodiment of policy for school children. Now we are talking just about the policy, but when it comes to health policy, the importance of a good healthcare policy as a determinant to overall health of the population is being widely recognized, widely acknowledged. And if that is so, then my next question is, what do we mean by health policy? Yes, Ajay. Correct. Fine. Thank you. Any other thoughts? Yeah.
Health policy decision plan and action that undertaken to achieve specific healthcare goal.
Right. Specifically targeting at healthcare. Okay. Any decisions, bundle of decisions with a major goal or major target of achieving the health goal can be simply stated as a health policy. Okay. But it's very difficult to narrow down to one particular definition in health policy. There are several scholars who have given different definitions. Okay. But still, an interesting one from Walt 1994, it may be concerned with the allocation of scarce resources, the process of influencing the determinants of health to improve health, or the actions of the government to promote health. Another one by WHO. Health policy refers to decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. So it differs from just the policy because we are looking at the healthcare goals. Okay. Now policies vary. The types of policies may affect the political behavior. And one way of differentiating policies is to divide them into high politics and low politics. Low politics or high politics, when we say. So when we talk about high politics, it's the macro level policy we talk about. Okay. Low politics are the micro level policies, sectorial policies. And the policy level could be either the national government policy, state government, regional authorities. In the low politics, we'll talk about Ministry of Health, local health authority institution, a policy at the clinic level, a policy of a hospital, could be categorized or divided across the health, high politics and the low politics. There's another classification given by Lowy. He talks in terms of distributive policies, regulatory policies, redistributive policies, and constituent policies. So distributive policies are mostly focusing on allocating resources and benefits to specific groups. Regulatory policies, they are to control and restrict behavior to achieve public goals. Redistributive policies shift resources from one group to another to promote equity. So there could be a marginalized group and there could be a group which is more privileged. So whether there is a provision to redistribute the resources so that even the marginalized are benefited from the policy. And constituent policies are those with established or reformed government structures and procedures. Can we think about any health policies in India? Any example that comes to your mind? Okay, universal health coverage. Mental health policies, right? Immunization or vaccination policy. Vaccination policy. What else? One Health. What about India's national health policy? Have you ever come across it? Okay. Do you remember this? Ayushman Bharat. We hear about it every often. Pradhan Mantri Jan Arogya Yojana. What is the nature of this policy? Is it distributive, redistributive, regulatory, constituency? Huh? Why it is redistributive?
Yeah, the concept was made at like Delhi at the union level. So then they are redistributing it to all the states. Again, from the state, they are customizing it to state level health policies and they are adding funds to that and they are redistributing to the, so it
Right.
comes under redistributive health policy.
Correct. So it by and large, it may be called as a distributive policy, but still in one way or the other, it is also a redistributive policy, because it is talking about, like targeting a group, okay, and increasing financial protection to a certain set of population. What about this? Exactly. This is regulatory in nature, because we are regulating the essential medicine prices, we are regulating, like how the prices have been controlled and sort of thing. What is the nature of this policy? It's a mix. Yes, very good. It's a mix. It cuts across all the 4 domains. Okay, it's distributive because it focuses on expanding healthcare services and public health infrastructure. It is also regulatory in nature because it sets standards and guidelines for healthcare service delivery. It is also redistributive in nature, just the example that we saw, Ayushman Bharat. Okay, it is also in one way, we are saying it's a redistributive. But it is also constituent policy in itself, because it involves governance reforms such as decentralization of healthcare services, but its primary focus is on distribution and regulation. So, rightly said. What about this? Regulatory? Distributive? It's basically a constituent policy, okay, because it refers to the policies that establish or restructure government institution. This policy is about restructuring, okay, it is restructuring, okay, so they replace the Medical Council of India with the National Medical Commission, okay, so that's what constituent policy is. So are we clear now so far? What are the 4 types we looked into? Distributive, regulatory, redistributive, constitutive. One of the smartest batches. Wonderful. Okay, so importance of health policy. It shapes the healthcare system. Do we agree with this? We have been looking into health system, different aspects of health system. We are drawing our conceptual frameworks. Okay, but we need a policy, okay, that could strengthen or shape our healthcare system. It addresses social determinants of health. Does it? Yeah? Ayushman Bharat? Okay? It will help to address the social determinants of health. Ensures equitable access to healthcare, improves health outcomes, and guides resource allocation on priority setting. We are in this course. By now we have got a clear idea that health policies and health systems are not separate entities. HPSR is a recognition that everything is connected. Okay, so health policies will shape health systems, but health systems will also help us, studies of health system, how to restructure our policies. See, interestingly, there's a book on anthropology of policy where Shore and Wright, referring to Arthur Koestler's book called Ghost in the Machine, they tried to think about policy as the ghost in the machine, the force which breathes life and purpose into the machinery of government and animates the otherwise dead hand of bureaucracy. Interesting, isn't it? So it also demonstrates the kind of relationship policy and system has, like one cannot function without the other. It's like breathing in the life in the health system. If you don't have a health policy, okay, a health system will, maybe as a structure it will survive, but the functions would be limited. It won't function the way it intended. Remember, defining policy or healthcare policy is in a clear and universally accepted manner remains a significant challenge. But to put it in simple words, it is purposive course of action, or it could be a product of political influence, decision with a purpose, a bundle of decisions, and collection of ideas. Okay, some references. Let's move on to the policy making cycle. Any idea about the policy making cycle? What are the different stages of policy making cycle? Ever read about it? Mm-hmm. Okay, identification of a problem. No, you are talking about the research cycle. I'm trying to understand the policy making cycle. You're talking about the implementation strategy now. We'll come to that. That is one aspect of the whole policy cycle you're highlighting. Okay. So when we talk about stages of policy cycle, by and large, people will agree that there are 4 stages. Some people will say there are 5. So problem identification and issue recognition. Then we talk about policy formulation. Then we talk about policy implementation. And then policy evaluation. This is the most simplistic form of the policy cycle. But there are alternative explanations, like Kingdom will talk in terms of the setting of the agenda, then the specification of alternatives from which a choice is to be made, an authoritative choice among those specified alternatives, and the implementation of the decision. While on the other hand, Hogwood and Gunn would give us a list of 9 different steps which you would think of the policy cycle. So when we talk about these 4 stages of policy cycle, the first one is all about the process of identifying and prioritizing the issues to be addressed. Okay. We gave you a broad idea, and you started working on and trying to identify the key process of prioritizing, like what needs to be prioritized within that problematic situation. Then once you do that, the next stage is about developing policy options and assessing their feasibility. Will this work? Will this not work? Who will support? What could be the barriers? Policy implementation, turning policy decisions into practice. That's the place where most of us are interested in. We want to go and see whether the policy is getting implemented the way it was intended to be. And many times what we come up with is, sir, there is a policy gap. Okay. Policy evaluation, measuring policy effectiveness. Whether a particular vaccine policy that was launched, okay, has it really influenced the prevalence rate? Has it impacted on the community in a certain way? Okay. Whether that policy is a success or a failure, it's the evaluation that will help us answer those. So policy, the first process will help us understand questions such as like, how do issues get to the policy agenda? There has to be some kind of mechanism. Why do some issues not even get discussed? In the policy formulation stage, who formulates the policy? Okay. How is it formulated? Where do initiatives come from? Policy implementation, often, like one of the most important aspects of policy, yet often gets short shrift. What resources are there available? Who should be involved? How can implementation be enforced? And what happens once a policy is put into effect? Is it monitored? Does it achieve its objectives? Does it have unintended consequences? Now remember, policy making is a complex process, influenced by various actors, institutions, and socio-political context. And that's why theoretical frameworks help us to understand the process systematically. We need to have some kind of a framework. There has to be some theory, because it might look simple. Oh, there are wonderful these 4 stages. But does in the real world this work in that logical sequence? So there are different frameworks and models. So these are some of the key models of frameworks used in policy making. The stages heuristic model, the incrementalist model, multiple streams model, advocacy coalition framework, punctuated equilibrium, and institutional analysis. I'll just quickly run through it. Stages heuristic, one of the most simplistic models. Okay? It says like there are clear stages: agenda setting, policy formulation, policy adoption, and evaluation. But there is a criticism. People say it's very linear. Okay, it shows as if, like one thing will happen and then it will lead to the next thing. Okay, but it does not capture the complexity of policy making. No doubt, this still gives us a broader framework in terms of thinking of different stages of the policy cycle. Then there is an incrementalist model that says that policy is an evolutionary step-by-step process. Decisions are made through small incremental adjustments rather than drastic shifts. So some kind of an alteration, some smaller changes. So the previous policy which is already existing will be the foundation one. It will still be unchanged, but there will be small incremental changes that will keep happening to the policy. The strength, it is more realistic and practical approach, but at the same time there are criticism that it can lead to policy stagnation and resist to bold reform. Because if somebody comes and says, no, this needs to be drastically changed, we need a complete reform, but then this model will restrict it. No, because it will go in an incremental way. One of my favorite models is this Kingdon's multiple streams model. He nicely talks about the three streams. He says there is a problem stream somewhere, there is a problem stream flowing, then there is a policy solution stream also flowing, and then there is a politics stream. Unless they all come to a window, unless they all strike each other, there is no scope for policy formulation. So there will be instances when the problem and policy will align, okay, but then there is no political will, okay. Or sometimes the politics and policy will go hand in hand, but then there may be no problem statement available. Or in the third scenario, even it will be the politics and problem. Politicians will be highlighting, okay, there is a problem we need to do, but we don't have a solution. So the action will happen when all these streams come together in a policy window. So what Kingdon says is, I can trace the paths of ideas, but my personal theory is that people plant seeds every day. There are a lot of ideas around and there is no lacking of ideas. The real question is, which of these ideas will catch hold? When you plant a seed, you need rain, you need soil, and luck. Okay, so there are definitely multiple streams, that need to come together. I would recommend you guys should definitely read this paper on agenda setting, okay, by Anushka Kalita and Kevin Crow. It talks about the politics of health policy agenda setting in India, the case of PMJY program. Very beautifully, they have across the time scale given details about the politics streams, the problem stream, the policy stream, and how ultimately, the policy window tried to bring in these streams together. Another framework by Paul Sabatier and Jenkins is about advocacy coalition framework. The policy actors from coalition are based on shared beliefs. So people will come together. There will be a coalition based on the shared beliefs, and external shocks or policy learned can lead to change. Similarly, you can talk about punctuated equilibrium theory, you can talk about institutional analysis, and so on. Just a comparative table to show, different frameworks. So definitely you will get the slides, okay? So you can relook at this table and try to understand it. So remember, there is no single framework that fully captures the complexity of policy making. Understanding multiple theories helps in analyzing policy changes. Choosing a framework depends on the policy issue and context. What exactly are you looking in the policy analysis, or which aspect of the policy are you looking into? Future research should integrate multiple perspectives for a holistic understanding. So nobody can claim, okay, this is the only model or this is the only theory, or there are many people who are fascinated by Kingdon's framework. So they might say, no, I want to apply Kingdon's framework everywhere. It may not work. So we may need to draw on different theories and framework. And thirdly, coming to the health policy triangle. Have you heard about this health policy triangle? There was an interesting triangle on day one on that group. They had, like nicely drawn the patient, policymakers, and what was the third angle? Care provider. Okay. So this is a slightly different triangle. Okay. But the first question comes to our mind: why study health policy? Is there even a need to study health policy? Because policymakers are already there. They have made wonderful policies. Okay. Things are going. Why does it need? Definitely we need to understand who makes the policy decisions. It's all about power. To understand how and why these decisions are made, the processes. To learn about the contents of existing national and global health policies. And to learn how to plan and make policies. And why we need to understand is to better understand and contribute to the change. Okay. Policy analysis is a multidisciplinary approach, aims to explain the interaction between institutions, interests, and ideas of the policy process. Now, policy analysis could be retrospective or it could be prospective. Retrospective, you look at the past policies, try to analyze them, whether the policy was a success or a failure. You are going back. Retrospectively, you are looking at a particular policy. But prescriptive policy is the prescriptions for policy. That means the policy is not yet been formed. So we want to plan for a future policy implementation. So we are doing a study. I'm going to give you some examples towards the end of this particular section. Okay, in terms of like how prospectively and retrospectively you can look at policy analysis. People also talk in terms of analysis of an analysis for policy. So when you talk about analysis of policy, the policy in itself is the object of your study. Offers an account of the nature and processes by which policy is made. Policy is the object of study. Focuses on policy formulation, process analysis and content analysis. So out here, I would be interested in understanding policy implementation. I would also be interested in understanding how in the first place the policy got formulated. Or I might just be interested in understanding the content analysis. What is the content? What are the written things in that policy document? Analysis for policy. Focus on the needs of the policymaker and is a form of decision support. Something is yet to be formed. So our research would help decision makers form the policies. Attempts to provide evidence that influence policy. Okay, this all exercises that we are doing now, we are coming up with wonderful ideas. We are coming up with wonderful conceptual frameworks and we want to go and gather information. So what are we doing in this process? We are generating evidence and we want this evidence to be used by decision makers to form appropriate policies. Sometimes we may get stuck in whether it should be only content analysis or process analysis. Is it only about what was the policy goal or what interventions were recommended, what was written in the document? No, it is also equally important that we look it into the processes part, like how did the issue get onto the agenda? Did people fight about it? Was there a lot of political cry over there? Okay. Was the political stream very strong over there? Why did change happen at a particular time and not at others? We know a lot of things happened during COVID-19. Okay. We are going to look into that example. Can we explain policy change? And why process is important? Because remember, policies rarely are made on the basis of medical evidence alone. Okay. Most of us are doing wonderful PhDs, okay, and after we do our PhDs, we always want our work to be recognized by policymakers, okay, especially people who work on policy issues. They want their paper, their publication to go as an evidence, okay. But is it the only evidence that the policymaker is going to look into? No. The use of evidence itself is political. Do you agree? Anybody disagree here? Okay. Need for health policy reforms. Prescriptions for policy change abound. And that's why questions remain like, how should reform be carried out? Who will support and who will obstruct? What factors will influence implementation? And when is the best time to introduce change? Okay. So during COVID-19 vaccine, in one of the states we saw, there was also another vaccine, child vaccine that was implemented. And because of COVID vaccines, all that misconception, people also neglected that particular vaccine. Okay. What happened? Was it the right time to introduce that vaccine? We don't know, because it had an effect on it. So Walt and Gilson gives us this very interesting framework called as the policy triangle to do any kind of a policy analysis. They talk in terms of the 4 interrelated components: context, content, process, and actors. So context could be political, economic, social, and cultural environment. Yesterday, if you recollect, Karina, in one of her slides, she has already started talking about the various forms of context. Content, the actual policy, the laws, the regulation, the strategies, the process, the policy making stages. Actors, it could be individuals, it could be groups, organizations, and institutions involved. Let's look into the context component. There is a useful categorization of factors by Leacher. He talks about factors, that factors could be situational. So within the context, there are different factors he's talking. There could be situational factors, there could be structural factors, there could be cultural factors, or there could be external factors as well. For example, in situational, more or less transient or idiosyncratic conditions which may influence policy. There could be war, there could be a drought, COVID-19 pandemic influencing emergency health policies, India's rapid vaccine rollout. The situation was so much terrific at that time that we had to take fast decisions. Structural, relatively unchanging elements of the society, political system, economy, or even the religion as a system could have a structural component. Cultural, the value commitments are prevalent within the polity or system, vaccine hesitancy and traditional medicine preferences in various countries. External, so somebody may be interested in understanding only the context component and say, okay, what happened when in the implementation process, like how did context influence this whole process? And then he or she may want to look into these factors. The content component describes the actual policies, their objectives, and their components. So basically, what is the content of the policy in itself? What are the goals of the policy? What mechanisms are used? Is it taxation? Is it talking about the regulation? People out there were talking about the regulation of private sector, for instance. Are there any subsidies? Okay. Are there any incentivization that is happening? Okay. For Ashas, for instance. Okay. What does that policy talks about? How is equity and access addressed? In your case yesterday, you were talking about the access part. Whether the RTA policy also touches upon the access issue. Whether the content, whatever is written material, is actually addressing those things. The process component. The process component is all about the stages of the policy cycle. So it could be agenda setting, it could be policy formulation, it could be the implementation, or it could be the evaluation. So somebody using the policy triangle may say, like, I want to just use the implementation part and understand what has happened after the implementation stage. So just to give some more slides on implementation. So health policy implementation is the process of turning policy into practice. So there is a policy and there are practices. And many times we see there are policy practices, gaps are there, and our studies contribute to understand why those gaps are and can be feedback to policy revision. So policy implementation often involves three types of methods. One is the top-down approach, that, as you said, Ajay, rightly in the beginning, the bottom-up, okay, and the principal agent approach. There are different definitions, like policy implementation encompasses those actions by public or private individuals or group that are directed at the achievement of objectives set forth in a prior policy decisions. Analyzing policy implementation, people can take a top-down perspective or they could be a bottom-up perspective. From a top-down perspective, implementation is a rational process. It's very hierarchy controlled. Somebody sitting at the top, he has laid down the policy and implementers are told that they have to abide by the policy guidelines. They have to follow the way it is meant to be. It is very hierarchy controlled. It is pre-planned and controlled by policy planners. Policy is an independent variable and more deductive in nature. Sometimes we say in a day-to-day conversation, it's a very top-down approach. Okay, because as implementers or as people in the department, students, we may say like, principal's decision or HOD's decision is very top-down. He's not talking to us. Okay, he's not considering what our challenges are. But vis-a-vis, bottom-up perspective thinks in terms of implementation as an interactive process. There is a local autonomy. Implementers often play an important function. Policy is and dependent upon interaction between actors at the local level, and it is essentially inductive. Okay. Like what happens at the traffic signals. If you're not wearing a helmet, how much fine we have? 500 rupees. That's a policy decision. Okay. Also a law enforcing. Okay. But what happens if you don't pay 500? There is a different policy that is prevalent over there. Okay. You will immediately put your hand in the pocket, and so the policy implementer, the person at the traffic signal, the traffic police, what he will do is like, he will implement the policy in a different way. There will be a subversion of the policy. Okay. And in that light, there are different models or frameworks or theories. One which is widely famous is the street level bureaucracy that Lipsky talks about. So Lipsky describes implementation of policy as highly influenced by the street level bureaucrats. That is the frontline staff who can change policies significantly. Not to say, but sometimes like in departments also. Okay, people who are on the front line, maybe the non-teaching staff. Okay, they will turn the policies. Okay, they will handle certain things in a very different and an innovative way. Okay, so these frontline people are the actual implementers of the policy. Similarly, Elmore will talk about backward mapping process, where knowledge and problem solving ability, incentive structures and bargaining relationships are seen at various levels. Similarly, implementation structures, and Barrett and Fudge will talk about policy and action as a negotiation process. Okay, so there is a policy cannot be regarded as a fix. It is mediated by actors who operate and implement. So they will meditate it. There is a negotiation process constantly going on, and they will implement it. So this I talked about street level bureaucracy. An interesting paper, quite an old paper, but a very interesting paper to understand how like frontline workers in any kind of a health setting, okay, respond to the policy changes and how they alter the policies. So this was one of the papers like we read long back. We are bitter but we are satisfied. Nurses as street level bureaucrats in South Africa. So even in all of your problem analysis that you are doing, the conceptual framework, think in terms of who are those frontline people, who are the actual implementers, okay? And how will they change or modify or subvert the policy? And the fourth component within the policy triangle is the actor component. Individuals and groups basically who influence the policy decisions. They could be state actors. They could be non-state actors. NGOs, private sector, donors, and civil society. International organizations like WHO, World Bank, and Global Fund. On the very first day, your group gave us a very nice overview of the way they had drawn their diagram. They started from WHO and they came till the periphery level. They showed us the different levels of actors as they understood the health system. Okay. I borrowed this slide from the Keystone one. So, actors are state-specific actors, ministries and bureaucracy, non-state actors, okay, civil societies, interest group, actors who may contribute on the both sides, networks, and street-level bureaucrats, okay, who fall within the state actors, and they are the one who are the actual implementers of the policy. Why use the policy triangle? Helps in understanding the power dynamics and political economy of health policies. Useful for policymakers, we researchers, and stakeholders in policy analysis. Applicable across different health systems and income settings. Now, using policy triangle, if you do a retrospective analysis, you can pick any particular policy. You can see, like, if there is a policy around RTA, or if there is a PPM-TB policy over there, or what does the digitalization of ASHA, is there a policy document around it? Okay, and do a policy analysis, see what the content is saying about it. What were the stated, unstated aims? What were the level of fees, various services? Context, economic, ideological, cultural circumstances. Actors, who are the main actors involved in it? Processes, be it top-down or bottom-up. How was policy communicated? How was it implemented? Did it reflect original plan? Or how is it getting implemented at the moment of time? The digitalization of ASHA, for instance, you might think of. Or even the CHOs sitting out there. What has happened with their new positions in the system? A very familiar example, like a recent thing that we have all faced. We have gone through this pandemic time, and we know, like there are a lot of emergency decisions that we're taking. If somebody is more interested in to understand, he can apply policy triangle in understanding the India's vaccine rollout. What are the context factors? Global pandemic, economic crisis, health systems, strain, content, health financing, vaccine policies, processes, emergency decision making, international conditions. Okay, and within that, how governments have worked, what WHO role WHO played, private sector, vaccine manufacturers, various of the different companies. Okay, every now and then when vaccine production was happening, okay, the news were flooded with all these interactions. What did government deal? What was the deal going on? Who was overpowering? What were the decisions, and so on. So somebody can relook at it and try to analyze it retrospectively. Using policy analysis prospectively, as I said, for instance, India doesn't have a vaccine on respiratory syncytial virus. So one of the studies that I have been engaged with is trying to look for a prospective policy analysis for launch of respiratory syncytial virus in India. So the content, what are the components and cost of the policy? Will it be a burden to the system? An additional one more vaccine within the existing pool of vaccines. Context, will it be a national, or we want to make it state specific because maybe a particular state might have a high prevalence, or it could be a local policy. Importance of RSV in the population. Are there any other country policies? Can we borrow, can we think of? How are vaccines perceived in the population? What is the discourse around PSV? Who could be the actors? Who will support this policy? Who will resist? How to neutralize? Who can resist this kind of a policy? Sometimes parents as stakeholders can say, कितने टीका लगाओगे हमारे बच्चों को? How many times will you prick? Okay. So there have been concerns from the receiver side, from the beneficiary point of view. People have showed concerns in this study that, okay, we are worried about the multiple pricks, that what they would call. Processes, how is public health policy made at country level. So what is the ideal way how India looks at, okay, the policy framework? Are there paths for compromise? So during COVID-19, we have seen that. So prospectively, can we also think about some of these aspects? Benefits of policy analysis, rich explanations of why and how policy outcomes were or were not achieved. Tools to make future policy designs and implementations more effective, and strategies to improve policy outcome. I think this is my last second slide, linking it back with the HPSR thing. If some questions we need to think through, or even the questions that you are working on, now that you have submitted those questions, I know you don't have time to revise them, but you can think about it. How does a new healthcare policy impact access to care for marginalized populations? What are the unintended consequences of policy change on healthcare delivery? How can stakeholder engagement be optimized to ensure successful policy implementation of PPM, for instance? What are the cost effectiveness implications of a proposed health policy? And so on. So you might need not think only in terms of policy, but you can link up the policy analysis in terms of the wider health systems framework. And finally, to conclude, health policy is vital for healthcare systems. Policy making cycle ensures systematic decision making. Policy triangle aids in policy analysis, and continuous evaluation is essential. So that's where I can stop my presentation, and I hope you have got some idea in terms of like what health policy is all about at the end of the day, and within the HPSR framework, how health systems and health policies are not separate, but they are tied up to each other closely. So if you have any other questions, we could definitely take up those questions during the tea break or during the lunch time. But now I would like to pause here. Yeah, we'll stop here and we'll take a break for 5 minutes, and then I'll hand over it to Karina.